next meridian is the gallbladder meridian. This meridian is all about the sides of the body. And this meridian gets kind of crazy. It kind of jumps all over the sides. So just know that this meridian really takes a big cut of real estate all along the sides of the body here. The gallbladder meridian begins here at the temple. It then comes over into the hairline and then comes up to the corner of the hairline. It then drops back down and again traces around the ear. So if the triple burner is about 1 inch off of the ear, the gallbladder meridian is about 2 inches off the ear, and it traces all the way down to the nape of the neck. It then jumps back up the skull and comes up to about 1 inch above the center of the eyebrow, and then traces back down the skull about 1.5 inches off of midline. So if the bladder meridian is about 1 inch off of midline, this is 1.5 inches off of midline. Coming back down to the neck, it crosses over through the top of the shoulder. And then it comes down and emerges at the mid-axillary line at the 5th intercostal space. It then zigzags across the front of the body to meet with the 11th rib, and then comes back to midline. It then comes forward to meet with the anterior superior iliac spine, and then comes back to the midline, passing through the greater trochanter, and then comes down straight through the IT band, down the lateral portion of the knee. It then connects with the head of the fibula, coming straight down the lateral aspect of the leg. It then passes through the anterior portion of the lateral malleolus, and then comes down the dorsal aspect of the foot between the 4th and the 5th metatarsal, terminating at the lateral corner of the 4th toe. Symptomology of the gallbladder channel includes alternating fever and chills, so like that state of sickness, maybe you're first starting to get sick and you're hot and you're cold, you have fever and you have chills. That's a pain, the symptomology of the gallbladder channel. The gallbladder channel has everything to do with the sides of the body. So when you get a headache on the side of the head, ear pain, pain in the side of the neck, as well as pain along the costal margin, as pain in the hip, as well as pain like the trochanteric bursitis, things like that, are symptomology of the gallbladder meridian, as well as anything to do with the IT band, has to do with the anterior aspect of the lateral malleolus, so this lateral type of ankle pain, as well as pain or dysfunction in the dorsum of the foot, especially this lateral portion of the dorsum of the foot.
If you found this video useful and want to see more like this, make sure you subscribe below and don't forget to hit the notification bell.